Good afternoon, everybody. Thank you for joining us. We'll be starting at 12 o'clock.
Sorry, Miha, there's no sound coming through.
Bear with us for just a moment, please. A small technical fault there. We'll just re-share the slides and hopefully you'll be able to hear it this time round.
At scale like other The potential of data analytics in general in healthcare is just absolutely enormous. It's the case that lots of people haven't had the opportunity to analyse it at scale like other industries might have done.
There's 56 million people live in England. We'll each have on average 6 healthcare consultations a year. Now, that is just niche healthcare. When you include the personal data that you collect from your Fitbit or from your phone accelerometer or information you've had about yourself, the data set is massive.
Most of the exciting and interesting unanswered questions in medicine today can only be answered with data at huge scale.
The better insight you have and the quicker you can get to that insight, the quicker you can improve the way you treat a disease or building new vaccines, for example.
Unlocking the potential of routine healthcare data is really huge.
Using the cloud and some of the powers of modern technology is the only way you could begin to process this kind of quantity of data.
It's going to have researched the first time a platform where they can create, test and implement algorithms to help improve healthcare outcomes. And that's going to be where we'll see the real power of EMIS X come through.
I think everything we can do to push forward the better, safer, faster and cheaper use of data at scale is to the good of everyone.
This has the potential to completely change the way that we deliver healthcare. It has the potential to change the intrinsic role of healthcare professionals, such as a doctor, and it has the potential to massively change how we organise our services.
Good afternoon, everybody, and a very warm welcome to this afternoon's EMIS live session on patient identification. My name is John McCormack, and I'll be your host for this afternoon. So as you just heard in the video, the potential of data analytics in healthcare data is huge. So what is it that's preventing us from capitalising on that potential? Now, clearly, there's a number of reasons for it, and you just heard on the video some of those spoken about. But a big part of it is about the actual access and accessibility of data. Healthcare data resides in source systems like EMIS Web, which just simply aren't designed to support large-scale data analytics. So the answer to that question is you have to move the data from a source system into a system where analytics can be performed. Sure, in source systems you can do simple searches on coded data, but that can be time consuming. It can be quite clunky, as we'll show you later. And it simply isn't as effective as using modern data analytics techniques. A recent study showed a 268% increase in patients identified using modern data analytics capabilities when compared to simple searches on coded data. So the answer historically has been to move the data to the analytics. But these are huge quantities of complex data that we're talking about, and it is not trivial to move those quantities of data about and keep it up to date in a reliable fashion. Add to that the privacy, legal, ethical and compliance considerations that sit around it, and it can be really quite difficult to move data to the analytics. And this is the problem that we sought to solve when we created EMIS X Analytics, because what that provides you is the ability to move the analytics to the data. Next slide, please, Mihad. So there's a huge amount of investment in UK health tech, and a huge proportion of that huge investment is going into creating modern AI, machine learning, data analytics techniques. Government policy and NHS strategy are all calling for better use of AI and data analytics to help detect, diagnose and treat patients earlier. EMIS Pathway is our answer to that solution and allows for that to happen. And here is how.
Together, we can build healthier futures. The detection and prevention of high-burden diseases can save unnecessary pain and suffering for patients, preventing serious complications from the onset of disease. At the same time, intervention and diagnosis can reduce the scale and cost of treatment for healthcare providers. In 2021, the government's Life Sciences Vision called out the use of AI to aid early diagnosis as an area of focus, bringing together the NHS, research and the life sciences industry to identify, diagnose and treat at-risk patients. By working in partnership with the research and life science industry, it is possible to apply modern data science techniques to primary care data to identify risk factors and earlier diagnosis of disease. These insights can be delivered directly within point-of-care systems, delivering a seamless integration of workflow. EMIS Pathway is an integrated solution within EMIS Web designed to empower GPs to easily identify cohorts of patients who could benefit from early intervention. Working in partnership with industry, clinically designed searches can enhance patient care and improve outcomes. Let's look at an example. In the UK, an estimated 118,000 people are chronically infected with hepatitis C, with reports estimating that around 2/3 of people living with hepatitis C may not realise they have the virus. The government's hepatitis C virus elimination programme is working towards a shared goal of eliminating hepatitis C as a major public health issue in England by 2025. Pharmaceutical companies are working in partnership with NHS England and have developed patient searches to help people recognise the risk of infection. At EMIS, we have significantly invested in our vision of connecting healthcare, bringing research and industry together to support these programmes to build healthier futures. Our data lake supports secure, ethical and governed access to healthcare data, consisting of over 38 million primary care records, protected by our security layer powered by EMIS X. Where appropriate data permissions are in place, researchers and data scientists build and apply techniques to identify clinical cohorts of patients, in this case, those at greater risk of hepatitis C. EMIS Pathway then joins the dots by surfacing the actionable insights back into clinical workflow with EMIS point-of-care systems. By developing long-term partnerships with the research and life science industry, EMIS Pathway will help to accelerate programs like the Hepatitis C Elimination Programme, bridging the gap and connecting healthcare solutions that improve the lives of patients.
So with EMIS Pathway, you can now bring the analytics to the data. And we're already doing that with, in some cases, relatively simple data algorithms, and in some cases, very sophisticated machine learning algorithms to help identify patients earlier in the way that was just described. So this afternoon, the agenda is that we will ask Mike Williams in just a second to take you through a short demonstration of the existing functionality that's in EMIS Web, the sort of thing that you can do to use searches to identify cohorts of patients. And then Mihad Mohammed, one of our senior product managers, will talk to you a little bit about and show you a little bit about EMIS Pathway and how that is able to build upon that capability. So without further ado, I'll hand over to Mike. Please do ask any questions in the chat, by the way, as we go through this. We'll be coming to your questions at the end. Mike, over to you.
Thanks, John. So what I'm going to be walking through, as John said, is the current functionality and capabilities within EMIS Web to be able to create a cohort of patients through searches and then apply point of care or patient context information to that patient to allow you to easily recognize that a patient is part of a risk group, a cohort of patients, or needs that actionable insight piece that John referred to earlier. So I'm going to do this in a very basic way to talk you through kind of some of the steps that are available right now. You may already be doing some of these. So I'm going to go to our population reporting module. And what I'm going to do is build a very basic search that's going to look for patients that have multiple chronic conditions that are overdue significantly a medication review, indicating that they may be at risk of a certain condition. So I'm going to create my patient level search for multiple chronic conditions and overdue medication reviews. Bring in my patient population, and then I'm going to start putting the rules within my search here. So the core first rule is going to be that they have these multiple chronic conditions. Now, one of the things that you can't do currently is easily import a large list of codes that are appropriate, and Mihad will talk about some of the benefits that pathways will bring as we go through the presentation today. So I'm only going to select a couple chronic conditions just for the sake of speed. So in this example, I'm looking for patients who may have a diagnosis of asthma, CKD, and diabetes. And what I'm going to do is ensure that that count is more than one. So only include patients with more than one clinical code where the codes are those. Nice and simple. Then I'm going to add another rule to this, which is going to look for that overdue diary entry. So I'm going to be looking for patients with a medication review where the latest diary is over or before the current date. So it's not in the future, it's overdue already. So it's before the search date, so before the 8th of December. So at the moment, this search is now going to check, first of all, whether a patient has more than one chronic condition within their patient care record. Then it's going to move to the next rule and check to see if they've also got a diary entry to say that they're due a medication review and the date has gone past, it's overdue. So I'm going to save and run that, and hopefully it should return a single patient for my example, which it has. I'm able to view that cohort of patients here. And if I wanted to, I currently have the tools to be able to mail merge letters, whether that be for referral, for information to patient, or any other kind of document requirement. I can batch add warnings to them, protocols or clinical codes, as kind of required against that cohort of patients. So I'm able to identify a list or a cohort of patients here, but actually what I'd like to do is be able to see that within a patient context, that they're within that risk group and maybe need an intervention. So to flag that, I'm going to use a concept and a protocol alert to show that piece. So I'm navigating to Resource Publisher, and what I'm going to do is create a concept that's going to look for those appropriate things. So I'm going to add a concept, and what these do are effectively evaluate a patient's clinical record for either clinical codes, medications, or diaries, as you can see on my screen at the moment, and they use that to make a true or false statement about the record. Is this thing true? Is this false? You can then use protocols to link them together in a flowchart or pathway for it to then make logical decisions and present a final option, which we'll cover in just a second. So in terms of this clinical code concept, what I need it to do is evaluate if they have those multiple clinical codes or chronic conditions, as we previously showed within the search. So again, I'm going to be picking up those same 3 at quick speed, just to take you through what that might look like. So I've picked up my appropriate clinical codes, and what I want to do is check that there is more than one of those codes. So at the moment, what this will do when applied to a patient's record is it will check if a patient has clinical codes and there's more than one of them of those code types, and if so, it will pass that rule. If not, it will fail that rule. So I can save and close that now and give it a nice easy name. Do that. Then I need an appropriate rule to be able to do the same thing, but for the diary aspect of the concept. So I've got one to check for the clinical coding, and I could, if I was being smart, build these into a single concept and do rules based on a single concept, but for visibility, I'm going to do it as two separate pieces. So I'm going to do a diary concept, and again, it's going to search for patients that have diary entries related to, in this case, medication reviews. And what I want to do is take the latest code entry for that and check the time period that it's in is before today's date +1, so it's overdue. So what this is now going to do is give me 2 bits of logic. I've got my first one, which is going to check my chronic conditions, my second one, which is going to check whether they're overdue a medication review, and I'm going to save that up. And I'm going to create my pathway to register that patient point of care alert on the record. So one of the things I'll need to do is within Resource Publisher, I'll need to activate these to make sure that I can use them. And then I'm going to go and create my protocol. Obviously, these can be as complex or as simple. I've gone for a very simple solution to take you through, but obviously you may want to bring in different rule sets based on risk, what you're trying to actually identify, and these are just examples of the functionality that's available right now. So I've activated my concepts so that I can use them within my protocol, and now I'm going to move across and generate that actual protocol. So I'm going to use this folder. I'm going to create a protocol. So protocols within EMIS Web, for people who aren't familiar, effectively are pathways or flowcharts of both user-designed user decisions or system decisions to take you through a set of logical choices and activities that can be taking place. So for this, it's going to start, it's going to evaluate a concept. So it's going to evaluate my medication review to see if this patient is overdue a medication review. At that point, if it's false, I just wanted to back out. I'm not interested anymore. However, if it's true, I would then wanted to check that they've also got those multiple chronic conditions. So I'm going to bring it down there. And again, if that's not true, I want it to end. Now, if both of these scenarios are true, what I wanted to do is put an alert on the patient's record to say that they could be considered for perhaps an intervention by a pharmacist or some other insight or activity that you'd wish to take place, intervention at this point. So I'm going to give it a name, and I'm going to put in the messages that I want to be displayed on that patient. So intervention. So what I'm going to get to display is multiple LTC, consider as an example. When I hover over it, I may want to put in some more detail. I can set the alert priority. I can also change the date at which this is run, and I can choose where I want this to display. Now, for this example, I want to come up in the pink box in the bottom right-hand corner of a patient's record, which I'll show you in a second, but I also want it in there as a diary. By putting it in as a diary, it also means that I can search on it, which is useful for then looking within cohorts for things that have been resolved. I can just decide what type of alert it is, and if I wanted to, and if there was an activity, I could attach a library item to this protocol to allow someone to enter data by clicking on the alert. So that's off the back of this being true, it will then add that alert. And then I'm going to end it there. So when I save and close this up now, give it a name. This is protocol to establish and overdue medication view. I can now set some triggers for this protocol to tell it when to run. So by default, I'll need to activate it. And at the moment, it will do nothing. It's not attached to anything. It won't do anything. But if I go to manage triggers, I'm able to add a trigger to this particular protocol and tell it whenever I load a patient record, I want it to go through that pathway. I want it to check for medication and see if that review is overdue. I want it to go through their clinical codes and see if they've got more than one long-term condition. And then I want it to display that alert to me if those two things are true. So I'm going to tell it to do that. And you could be specific around certain job categories. You may only want that to happen for clinicians or maybe only for administrators, depending on the cohort and the activity that's driven out of it. Once I've done that piece, I click OK. And now if I navigate to a patient's record, so I'm going to go to patient record. At the moment, you see I've got my two pink boxes here. So that's the standard piece. So that's where the alert will appear once it's all activated. And as you can see, I'm just going to show you before we go through it that Susie has a medication review overdue. She also has asthma and CKD, although at 6 years old, that's probably fairly unlikely. So if I go back to my resource publisher now, I can check that my my protocol is ready to be used, and I can check my triggers, make sure everything's correct. What should happen is now next time I go onto Susie's record, if I clear her out and go back in, and I pick Susie, what should happen is I should get a third alert now in this bottom right hand corner, and it should inform me that I should be either contacting a pharmacist or something similar. When my alerts drive, no. So there we are. So now you can see I've got my multiple long-term condition, consider the pharmacy referral. And again, I could add a library item to this to be able to click on and trigger out. Now, as you've seen, there's a lot of steps through doing that to create both the patient context, to be able to batch add information, to generate up my search. Obviously, EMIS publish content around this through our library. Federations, PCNs and other areas will share content in the same way to be able to generate up these searches, these protocols and these concepts. I'm just here to show you the kind of existing functionality that's here today. What I'm going to do now is hand over to Mihad, and he's going to take you through the next kind of evolution of cohort management within EMIS Web through EMIS Pathways. So if I stop sharing my screen now, and I'm going to hand back over to Mihad. Mihad, are you okay to share your screen again?
Thanks, Mike. Get my slides up. Okay. As Mike showed you, there's a lot you can do in EMIS Web right now in terms of searches. And Pathway isn't a replacement for those searches that you can currently do, because that benefit will stay. But where Pathway comes from is we've taken inspiration from how you're currently using those searches to solve your problems in terms of identifying patients and risk stratifications, and building on top of it to give you a more holistic and a more expansive set of tools that are built on modern tech. So one thing we focused on is that current searches can be a bit distributed in EMIS Web. So we know you need a central place to go when you need access to external risk stratifications. So we've centralized the identification of patients, cohorts, and risk stratifications in one place, in one portal. That's the first point of Pathway. The second one really is we all now know in modern day, everyone's data is distributed in different sources. Everyone's health data is in different data sets. What the power of EMIS-X and EMIS-X Analytics does is allows us to bring data from different data sources, put it in one place, and run analytics on top of that. So as opposed to what the searchers can do, which is run searches on primary care data, what Pathway enables us to do is to combine data from different data sources and create a cohort set that's more comprehensive. The other, and perhaps the most important part of Pathway, is that it allows us to run simple searches if you need to, but more sophisticated modern algorithms and AIs on top of the data on our data lake, and then provide a patient cohort that otherwise might not be detected through searches. As John mentioned, there are studies to show that algorithms and modern AI can detect patients that are otherwise that cannot be detected with simple searches. So just in the next couple of slides, I'm going to show you some of functionality in Pathway that you can see in EMIS Web when it's launched. So the first part is we've made it easy for you to access to Pathway. So you can go in EMIS Web, you can go to portals, and you can click Pathway, and now you're in the EMIS Act powered Pathway solution. So here what we would have already done is we worked with partners and algorithm providers to select and run algorithms on this portal, so that you'll be able to select from here which ones are of interest to you. And on this portal, you will see what the search is about and how your patients can benefit from that, and which partners we worked with to get that Pathway solution into this portal. From here, if you click on View Pathway, you're able to see the list of patients that have been identified. It'll give some information about risk stratification and some other information that you might need about the patient. But perhaps just one point to highlight here is the actions button here. What we're doing is we're making sure the actions that you can take for the patient is one centralized in this page, but also it's contextualized, meaning that for different pathways, you will see different actions depending on what the objective of that pathway solution is. For example, here, I've clicked on one patient and I've said, I want to see the health record of this patient, and then immediately side by side, EMIS Web health record view opens up. And also I can say for this patient, put in an alert so that next time I'm in that patient's health record, there can be an alert showing that this person has been identified through this specific pathway. But also this is the other main important thing we're providing through Pathway, which is a dashboard which will give you a sense of how your patient population compares in terms of the identification through the pathway. For example, in this one, what you're seeing is your patient population who might or who have been diagnosed as Hep C, how that compares in terms of age ranges, in terms of risk factors, gender, and so on. But these dashboards as well will be customized based on each pathway to give you a high-level overview of what your patient population looks like for that specific algorithm, search, or AI. Really, that's a very quick whiz through of what Pathway looks like and what it can do. Right now, we're looking for early adopters. So if you're interested in being an early adopter, please follow this link. They will be provided in the chat as well. And if you have any questions, please put them in the chat window. Okay, over to you, John.
Thanks very much, Mihad, and thanks, Mike, for taking us through that. We are open to questions. If anybody would like to ask any questions, you can please enter those into the chat, and we will take your questions. I'm hoping Dr. Ian Wood has joined us by now, so that he can help support us on the Q&A. If there's any questions, please do enter them now. We haven't got any yet. It's very quiet today. Ian, have you joined us? I can't see him in the session just yet. No. Okay. If we don't have any questions, I think we may have to give people some time back. We've had 2 sessions this week, and we were inundated with questions. We spent about half of the time covering questions, so we've allowed quite a lot of time to cover questions today. But it seems as though we've been so clear in our articulation of this that nobody's got any clarification questions to ask. I mean, please do follow up with us separately. Here we go. What's the likely timescales for launch, Mihad?
Yes, so we're looking for Q1 for pilot projects, so a pilot program with our early adopters. So you can expect a full rollout in Q2 of next year.
Excellent. Thank you, Mihad. And I see Ian has joined us now as well. Welcome, Ian. We're just getting into some questions now.
Thank you.
Another question that's come along, with EMIS Pathways, can you export patient details once the algorithm has been run?
Yes, so we will decide that based on, like I mentioned, the actions will be contextualized based on the pathway. So based on what's required for that algorithm, we'll make it exportable. It is right now possible to do that.
Excellent. Please, can you put the email address for early adopters in the chat? Yeah, absolutely. We'll do that in just a minute. Sarah, if that's possible, if you could perhaps pop that in the chat for us, that would be good. Excellent. Ian, not to put you on the spot, but we've taken everybody through a little bit of background on EMIS X Analytics and the ability that we have to bring modern algorithms into EMIS X Analytics to help do better patient identification. We've taken people through existing search functionality that's available today in EMIS Web and how Pathway compares. I just wondered whether from a GP's perspective, you had any kind of any thoughts that you might want to share with the group whilst we wait for any other questions to come in, if indeed we get any.
Yeah, of course. Apologies, not being drawn. I had a double booking, but it's a really exciting platform for me, I think. And I know this will sound very simple, but at its simplest, EMIS Pathway allows us to do the most powerful patient identification across any appropriate data sources and then to importantly then take an action on top of that as well, which is something which that joined up process is not something we see anywhere else in the market. And when you apply that to the clinical domains, especially in places where we're seeing big problems at the moment with catch up on long-term disease care, we're seeing problems with identification of cancer patients, for example, who have been not yet come forward in the last 2 or 3 years. These kind of tools will give us much better ability to identify those patients earlier, more accurately, focus our resources where it's very restricted at the moment, to ensure that we're bringing standards of care back up to where it was pre-pandemic levels, and also then driving it further forward once we catch up as well.
Excellent. Thanks very much, Ian. We haven't got any further questions on the chat, so unless we get any in the next couple of minutes, I'll just wrap up and say thank you very much, everybody, for joining. Looks like we're going to give you a fair bit of time back, which I'm sure at this time of year people will be grateful for, because I know how busy you all are. So thank you very much again for taking the time out of your busy schedules to join us. Please do feel free to follow up. We will respond with further follow-up information to the email addresses that you've registered against, so that you know where to come to ask any further questions. Oh, somebody has just popped a question in. So sorry if you did mention it and I missed it. Will the algorithms be subject to machine learning? Mihad, do you want to take the first pop at that one?
Yeah, sure. Yes, it will be. So it will depend on different types of algorithms that we get, right? So it could be an open-ended algorithm or a closed box algorithm. But nevertheless, I think the important point to highlight is that all of it we will go through medical device registration and proper clinical review before we put it on the platform. Perhaps Ian, you can highlight some of the experiences we've had on that route.
I mean, you've alluded to it already, Mihad, but no, EMIS were the vanguards of your clinical information and also clinical safety, and it's always the number one checkbox, if you like, whenever new opportunities come through us. So machine learning is very much new in the NHS space and new in healthcare data compared to other sectors. We'll be ensuring that anything that does come through our Pathways platform, though, has been held to the same level of standards and rigor which any other tool which coming through EMIS Web would be as well.
Yeah, and just to add to that, it can be a variety of different techniques. So we've looked at using neural network functionality, machine learning, as you mentioned. It can be highly appropriate actually to implement relatively straightforward data algorithms. The ability we have here is to run that across massive data sets at scale. In a different way, essentially. So it can be a variety of different techniques. We're working with academic organizations that are producing new algorithms that are being, obviously going through all of the scrutiny that you would expect, being run through real world studies to demonstrate the efficacy of them, peer reviewed pieces of work, etc. So the key point here is, in each case, it will go through the scrutiny of our clinical teams, our clinical informaticians, and where appropriate, which isn't always, clearly there is medical device regulation to take into consideration as well. Another question been prompted, I think, by that discussion. When do new algorithms become available? What determines the type of algorithms that are developed? I'll have a first pop at that, and then I'll hand over to anybody else that wants to contribute. So your feedback, I think, first and foremost, we're very interested to hear what you would like. We're focused around the key areas, I think, of focus for us right now. Chronic conditions and chronic condition management is clearly a key focus area. We're seeing a lot of focus in the market, actually. There's lots of, as I mentioned earlier on, there's lots of investment into development of these kinds of capabilities, and rare disease management and rare disease patient identification is getting quite a lot of attention as well. So we're actively engaged with some partner organisations looking at developing capability around rare diseases, and initially our focus is going to be around the major chronic conditions. Ian, had anything to add to that?
You've already spoken just now about the partnerships that we've got. So where will these algorithms come from? Well, there will certainly be in time, I have no doubt, them coming into national guidance, and that will be in our interest to make sure our clinical system is as contemporary as possible to have those. So things like Q-risk, for example, or Q-fracture, those kind of tools which historically are in NICE guidance. We'll start to see some of these machine learning algorithms as well, I'm sure, come into that space. But we're also working with and partnering with some leading research organisations in the country who are doing this cutting edge development and research, and we'll be looking for ways and spaces to gather the evidence to support these tools in the application of healthcare. So there are the two main streams. There are the ones which the industry needs and is validated already and is ready to use and has the evidence to support them, and those also which are looking to make new ground.
Yeah, and what we're seeing typically is industry partners collaborating with leading academic organisations in this space. Vaccine management, for example, is something that we're looking at in detail at the moment with a partner. So, any other questions from anybody? Okay. I think we'll call time there then, as there's no other questions coming in. Thanks again, everybody, for your time. We will follow up with you with more information. Please do reach out to us if you have any further information. We're really interested in early adopters. So if anybody would like to register their interest to sign up to this service, we'll make sure that you get early access to the information about how to do that. Thanks again very much for all of your time and attention. We really appreciate it, and we hope you enjoyed the session. Enjoy the rest of your day and the rest of your week, and might be a little bit early, but Merry Christmas.
Thanks, everyone.